I'm a therapist, and I know what it's like to struggle finding a therapist. It can be confusing to know what I'm looking for, what would be a good fit. So in this video, I'd like to highlight a few characteristics of a good therapist and a few modalities that might help you narrow down your own search while we make some fluffy, soft hot dog buns. When I first conduct an initial intake session with a client, I often go over the fact that research suggests the therapeutic relationship is one of the most significant factors of success in therapy. I also let them know that while I hope we are a good fit, I'll take no offense if they decide it isn't working after a few sessions. And I have had several people decide it wasn't a fit for them. So as frustrating as that may sound, the first step towards finding a good therapist fit for you could be a little bit of trial and error. I also ask if they've had experience in therapy before and what was helpful or unhelpful in those previous relationships. I think in general, a good fit of a therapist may be dependent on both needs and personality. Some therapists work from a more directive lens, meaning they'll give you insights and challenge you with different coping skills to try, with sessions that might be more structured, where you come in and work through some laid out process, or you're given homework or worksheets to take home. A non-directive therapist may be more likely to let you come in and process whatever's happening most recently, giving you the reins to set the agenda for each session, while attempting to highlight or point out themes, patterns, or ways previous experiences may connect to the things you're currently processing. Again, these things may be personality dependent, and you may already know based on a gut reaction to what I just said which type of therapist you might prefer. Other general characteristics of a good therapist would be they seem to genuinely care. They're non-judgmental, curious, genuine or authentic, and empathetic. One of the most common complaints or negatives I hear about previous experiences are that the therapist talks too much about their own life or does not seem to listen well. I personally would say a therapist shouldn't talk much about their own experience, but I know for some people knowing their therapist can relate to them is important. So again, this could be personal preference. And feel free to request at the beginning of the relationship the level of self-disclosure you might be expecting or wanting from your therapist. In general, there are two different categories of types of treatment: top-down and bottom-up. Top-down approaches focus on cognitive processing, verbal communication, and present emotional awareness. These approaches might use techniques like those from cognitive behavioral therapy to help people change their thought patterns and learn coping strategies. Whereas bottom-up approaches focuses on the body's physiological and emotional states rather than cognitive processes. These approaches encourage people to connect with their bodies and experience their physical sensations. These are based on the idea that emotional regulation, trauma, and other psychological presentations are rooted in the nervous system. So I only have time to discuss a few main modalities, but there are others out there. If we were to paint these on a spectrum from top down to bottom up, on the far left of the spectrum I would put cognitive behavioral therapy, or CBT. And again, this approach is looking to challenge beliefs or thoughts about things in order to change how you might feel about it. So a therapist may make a plan with you on how to change negative beliefs. Acceptance and commitment therapy, or ACT, focuses more on accepting the thoughts and feelings as they come without necessarily trying to change them. It's based loosely on some of the cognitive behavioral therapy strategies, but involves a level of mindfulness as well. Personally, I think both of these strategies or modalities might be suited best for specific anxieties, obsessive-compulsive disorder, and potentially specific phobias as well. Dialectical behavioral therapy, or DBT, focuses on emotion regulation, especially emotion regulation skills. It was developed for the treatment of borderline personality disorder, but could be useful for anyone that feels they need more emotion regulation skills. On the bottom-up side of the spectrum, we might have modalities like EMDR, which is a trauma-focused modality that attempts to help engage both parts of the brain and reconsolidate past trauma memories and improve negative core beliefs. Internal family systems, or IFS, attempts to work with parts of ourselves that may have been exiled or wounded, and other parts that may be protectors. This type of modality attempts to build connection with those younger hurt parts of ourselves and finds resources from within. Keep an eye out for my next video on IFS that will do a deep dive into some of the things we can learn from the IFS model. Emotionally focused therapy and AEDP are both attachment-based, bottom-up approaches that may be useful for someone looking to heal from past family relationships that may be impacting their lives today. And somatic experiencing or somatic work attempts to use the physiological sensations to find healing and coping through the nervous system. Again, these are brief descriptions of some of these modalities, and there are others out there, but hopefully this helps you see what types of treatment you might be looking for. And I'll leave some links in the description for more information about some of these modalities. Thanks for watching. See you next time.